Now, I would like to invite Professor Mirela Tabaku, please.
Hello, everybody. I just would like to express my deep gratitude to Professor Ahmadi and to Azita for their excellent research job that they have done and for giving me the opportunity to present their work. Thank you very much. And the subject of my presentation is investigation of progesterone cytotoxic effects on colon cancer cells. Progesterone is a crucial hormone. It is primarily produced by the ovaries in the females, but in small amounts it's produced by the adrenal glands, and it plays several key roles in the body. Its primary function is to prepare the uterus for the pregnancy and to support early pregnancy. This is done by promoting the thickening of endometrium and inhibiting uterine contractions. But beyond the reproduction, progesterone has other important functions, which are to maintain bone density, to support the function of nervous system, to promote healthy sleep patterns, and to modulate the immune response. Furthermore, progesterone is involved in regulating metabolism to aid the conversion of fat into energy. Its multifaceted roles highlight the significance of progesterone in various physiological processes beyond the reproduction. The relation between sex steroids, one of them is progesterone, and cancer cells proliferation is very complex and often contradictory in the scientific literature. Some studies suggest that sex steroids can promote the proliferation of certain cancer cells, while other studies provide contradictory findings. These indicate a more nuanced and context-dependent relationship. There are many factors, and among them we can mention the specific type of cancer, individual hormonal profiles, and presence of other influencing factors. All of these can contribute to these conflicting results. Let's say a few words about colorectal cancer. It affects the colon, which is named also large intestine, or rectum. It is the third most common cancer in the world, accounting for around 10% of all cancer cases. It is considered to be the second leading cause of cancer-related deaths worldwide. It affects mainly people older than 50, but still, during the last years, there are younger people which are ill from colon cancer. Colon cancer and colorectal cancer share similar risk factors, symptoms, and treatments, but their specific anatomical location and potential disease progression may require different management strategies. What about inducible nitric oxide synthase, or INOS? It's an enzyme which is involved in the production of nitric oxide. It's a molecule with diverse physiological function, which include immune response regulation, neurotransmission, and vasodilation. In cancer, INOS has gathered significant attention due to its potential role in tumor development and progression. While INOS and its product, nitric oxide, has been implicated both in tumor-promoting and tumor-suppressive processes, the precise mechanism which underline their roles in cancer development and progression are still not fully understood. What about matrix metalloproteinase 9 or MMP9, which is an enzyme that breaks down extracellular matrix proteins? In cancer, it was seen that MMP9 is often overexpressed, promoting in this way tumor invasion, angiogenesis, and metastasis. All of this done by breaking down barriers in tissue, facilitating blood vessel formation, and modulating the tumor microenvironment. The aim of this study is to elucidate the cytotoxic effect of progesterone on colon cancer cells, which are named SW400AT, and also to evaluate the expression levels of INOS and MMP9 genes in these cells. These cells, SW400AT, were divided in two groups, untreated control group and group which are treated with different concentration of progesterone, varied from 125 till 1000 microgram per ml. The cell viability was assessed by using MTT assay, while quantitative RT-PCR was conducted to analyze the expression levels of INOS and MMP9 genes. Apoptosis in cancer cells was evaluated via flow cytometry. What are the results of this study? The findings showed that the high concentration of progesterone, 1000 microgram per ml, has a cytotoxic effect on colon cancer cells, which can you see clearly in this graph. In this cell, SW400AT, which were exposed to IC50 dose of progesterone, the INOS expression level was significantly decreased, while MMP9 expression level did not significantly change. So we may say that progesterone demonstrates cytotoxic effect on colon cancer cells, which was clearly evidenced by decreased cell viability and increased apoptosis. However, we have to say that low concentration of progesterone did not show cytotoxic effect on colon cancer cells. The downregulation of INOS gene expression suggested a potential mechanism which underlies these effects. However, further studies are needed to elucidate the therapeutic potential effect of progesterone in colon cancer treatment. Overall, understanding the association between progesterone and colon cancer, which involve a multifaceted investigation, particularly regarding its interplay with INOS and matrix metalloproteinase 9. Further research is essential to elucidate the intricate mechanism which underline this interaction and their implication in colon cancer development and progression. Clarifying this relationship could potentially pave the way for more targeted approaches to diagnosis, treatment, and prevention strategies for colon cancer. Thank you very much for your attention, time,